Good afternoon, everyone. My name is Gary Davies. I'm Head of Intervention in Bristol City Council. I use a quote that Desmond Tutu made, which was, at some point, we've got to stop taking dead bodies out of the river and go upstream and find out why they're falling in. And that fundamentally is the backdrop to the work that I do, really, intervening early to try and prevent children and families from needing to access either crisis services or moving into statutory services. And in order to do that, we decided to have a look at some of the data that we hold within Bristol to understand risk and vulnerability of children and families. And this work goes back to 2015, when we set up an analytical hub in one of the police stations as a joint venture between the police and Bristol City Council. And what we started to do was respond to the National Troubled Families Programme by bringing multi-agency data into a warehouse or lake, and also try to develop some predictive analytical capability. So at the heart of our work was the Think Family database. And then on top of that, we've developed using some click software, a strategic analytical tool, and also using some predictive work to try and identify children at risk of certain themes that we're most worried about. The Think Family database really is used for these four reasons. The difference, some of what you've been hearing today is very much focused on kind of research, academic use of data, and trying to work out trends and patterns. A lot of what I'm talking about today is actually delivering information to operational staff to enable them to make better decision makings. And that is particularly helpful in where you've got a role of making triaging decisions about children and family as to risk and vulnerability and what services they should access. But once you've brigaded this information together, what we have been able to use is to really utilise this information to understand the city as a whole and look at it strategically, understand where in the city is risk and harm, understand how we understand the volumes and nature of that in our commissioning decisions, but also to develop our local working so that we can look at individual wards, super output areas, police neighbourhood teams, and also provide information about predictive risk as we move forward. So the Think Family database is basically concludes every child and family that we know that we've got in the city of Bristol, which is 54,000 families, which involves around about 170,000 people. And it brings together about 35 different data sets on social issues. One of the big transformation pieces of work on this is that we used to use consent for capturing this type of information on children and families. We've now moved over to the legal gateways. And in order to do this work, we've had to be very, very sure about the stepping stones around our information governance in making sure our privacy notice, our impact assessments, information sharing agreements, and the audit and the security of the information is strong and sound. And so what we do is we use the various legislation that provides a responsibility or a statutory duty on the local authority to carry out certain types of work. So, for instance, the Crime and Disorder Act says about the responsibility to reduce crime and disorder, or the Children's Act says that we have a statutory responsibility to improve the health and well-being of children and families in our area. And these are a few slides just to give you an understanding of the type of data that we bring into the database. So there's information on antisocial behaviour, crime, domestic violence, substance misuse, some limited information on health because we have problems in exchanging information between health partners and ourselves. We get a download of information from the Department of Works and Pensions around financial exclusion, missing people, and then obviously our risk models that we've developed. We've got a direct feed into our school attendance and exclusion data. And obviously we know who we work with in terms of looked after children, children in need, child protection plans. The database is used by about 600 users in the local authority. There's about 5,000 searches a month. This is slightly old in that we've probably hit about 200,000 searches in the last 2 years. And it's, over time, it's become ingrained in working practices. So if a referral is now made about a child or family to our front door services, they'll immediately look up on the Think Family database. It will tell them information around risk and vulnerability, who's working with a child or family. And you obviously, not only do you get a better picture of those risks, it also is very business efficient in bringing a collection of information together at an easy point and very well visualized. So in looking at the Think Family database, when someone looks up a family, and this is anonymous data, but you will see, the name of a person, whether someone's working with that person, an overview of the indicators that they might hit, whether there's risk scores. The little coloured rectangles are flags of issues that are occurring within a family, and then there's some data-driven indicators below that you can see. If, for instance, you drill down into education, you can see whether a child was at school today, yesterday, last week, last month. You can map it as a trend over time, and it does that automatically. Things like this are particularly helpful if a family worker is working with a family. Some of our outcomes might be to try and improve school attendance. So the worker can go in and look up and see whether that school attendance has improved over time. We brigade families together. So you can look up an individual person, but you can also pull a family together. And we do that by pulling the relationships out of our case management system so that we can work out who is perhaps, mum, dad, siblings who live in the house. And there's a flexibility in the system where the worker can select who they choose to see in the family view. What it does do is it maps the indicators of a family over time. So what you can start to see on the right-hand side there is a trend about the indicators for that family as to whether it's increasing, it's stable, or decreasing. It also, we've done a range of work on predictive analytics. So some of the models that we've done around the risk of NEET or conduct disorder, child criminal exploitation. And what that does is it looks at, it's using some predictive modeling software. And for instance, for the risk of child sexual exploitation, we looked at a cohort of young people who've been sexually exploited. We trained the software to identify the risk factors that related to that cohort. And then, for instance, that has selected about 80 different risk factors. We then presented that at the whole database with about 50,000 children on it. It then scored those young people, and also for each of the risk factors, there's a tagline. So you would get a score and then a paragraph, and the paragraph would describe to the worker why that person has got the score they've got. So for instance, it may say that there's been domestic violence, they've got reducing school attendance over time, they've gone missing multiple times. We then put on top of the database some click-sensed analytics. And what that's enabled us to do is to do the strategic analysis at speed. So you can look at any part of the city, you can ask questions like, tell me who aged between 11 to 15 in the last 2 months has been subject to domestic violence in the south of Bristol, who's also got mental health issues, and it will instantly tell you that, and you can map that on charts, graphs, or geographically map it. So it's really about developing analytical products that meet an emerging business need. And what we've spent a particular amount of time is talking to practitioners so that it develops it in a way that links to operational activity. So it's not developed by analysts, it's developed by information needed to be known by operational practitioners. And then we take what they need to know back to the analysts and seek the development of the products. These are some of the models that I described to you that we've carried out. I'll give you a quick example of another one, which is NEET's risk of NEET. NEET is not being in education, employment, or training when you leave school. So we looked at 17-year-old young people who weren't in education, employment, or training. We understood their profile when they were, for instance, 12 or 13 years of age. We mapped the risk factors that surrounded them into the software. We then applied those risk factors to the current 12 and 13-year-olds in the city. that identified the risks of NEAT for a new cohort of people, and we're pushing that information out to schools so that they can start to respond to the children and young people that have got that high risk of NEAT. And just to say, part of our next steps is really to try and take this to external partners. We're desperately keen to bring in health data on risk and vulnerability because we realise we've only got part of the picture. We're working on with the Centre for Data Ethics and Innovation to develop an ethics framework. And I guess probably what I'd end by saying is really there's just a huge amount of scope and opportunity about using data in this way. So thank you for listening, and I'm not sure of the time, John, with questioning.